From the studies that have been done, when people search for health insurance on their own, only 15% of people choose the right plan. So my real recommendation is don't go it alone. It's try to find somebody that can help you. My name's Schneier, and I'm the CEO and co-founder of Trusty.care. And Trusty.care is working to make sure that no American goes bankrupt because of out-of-pocket healthcare costs. And we do that by making sure that people get into the right health insurance plan. Around 5 years ago, my younger brother got into a severe car accident. I got a call in the middle of the night, one of those terrible calls that you never want to get. And I flew into Nashville where he lived, and he had left his job in technology sales maybe 2 months before that, and was living the dream working as a chef. But what that meant was he had no health insurance. So I showed up at the hospital, and our whole family realized this is going to be a major financial impact on our family if we don't solve this. So we had to take this time to get him signed up for Medicaid in Tennessee that's called Trusty.care. And the process was just so difficult, figuring out what you're eligible for and how to manage everything. And it was a real moment for me where I realized this is something that is fundamentally flawed in the system. When people on their own try to get health insurance, when it's not just getting it from your employer, it's really complicated to navigate. And we started Trusty.care about 6 months later. So when we first started the company, what we thought was the problem was that consumers couldn't access the right health insurance, and that really all they needed was an educational system to get them into the right health insurance product. But as we began to build the company, what we realized was actually that most consumers were finding health insurance either through some kind of online platform, working with a broker, or going directly to a health insurer. And so the thing that we ended up building out is a platform that we sell actually to payers and also to people that sell health insurance to help the professionals guide people when they're accessing health insurance on their own. So it's a platform that's used by health insurance brokers, by payers to help guide people in their health insurance choice. So one of the things that we're really focused on right now is making sure that as somebody is guided in the process of picking health insurance, that we identify what are things beyond just the medications they take and the doctors that they see that matter in that choice. So some of those things are things like social determinants of health. Do they have a reason why they need a transportation benefit? Do they have issues where they're going to need assistance in their home? And making sure that those additional needs are met, because those are the things that you have to look at holistically, and where a lot of the health costs risk comes up. So we're really excited to go to this next level of really expanding out what we're offering to make it easier for people to get the right health insurance that covers all of their needs, not just the primary needs. So right now we have about 50,000 professionals using our system, and each of those professionals reach around 1,000 consumers. So it's a lot of people. So we're collecting a ton of data using claims data and self-reported data from consumers. And from all of that data, we're able to start to see trends in different areas of both things like certain medication requests, or understanding quality of a hospital compared to the demand for that hospital in a region, and that we're using all of that data to help guide people and to perfect the system to make it easier for them. So one of the things that we're really excited to do in the future is to take all this data that we're amassing from these millions of Americans across the country to start to go back to the payers and say, hey, here are some new benefits that you should be adding to your products to help people to afford their healthcare and to navigate the healthcare system. And we think that this could be a really great virtuous cycle to help both sides of the house, help a payer understand what they should be offering, and then also connect the consumer to the right health insurance product. People find themselves searching for health insurance plans at some key moments in their life. Could be that you've left your job and gone to work for Uber and you need to get onto a marketplace plan, or you're retiring and you're trying to navigate Medicare. And these are moments that can be really stressful to try to figure out what you're supposed to do. And what we find is that a lot of people look all over the place to try to get information. But one thing I would say is that there are a lot of people who are professionals that the sole thing that they do is to help guide people in this decision. And it's much easier and better to work with somebody than to try to manage it on your own. From the studies that have been done, when people search for health insurance on their own, only 15% of people choose the right plan. So my real recommendation is don't go it alone. It's try to find somebody that can help you. We are working now with a health insurer, a regional health plan, and when we first went and talked to them, they felt like that they were flying blind in understanding what their customers wanted and how they were going to be able to give them those needs. And the really interesting thing was that it wasn't just that they were trying to help the consumer, they also, just from a sales perspective, had no idea how to sell their products or what product they should be selling. So we walked in the door and the guy sat down and he said, I just need to break it down for people on the health side of the house, how difficult this is. We can't run a sales report. We can't run basic analytics to understand what our customers want. And so we've been helping that organization to both get access to a large market, but then also to understand how and what they should be selling to that audience. And that's been pretty exciting to see that it's guiding not only improving this sales and distribution process, but also in helping people to inform what the payer is doing to make sure that they change their plans to make sure they fit for their consumer.
Amazing.